in there.
Oh yeah, you can do it. Yeah, it's gonna be a little while. Let's do it. Think of the balloons in the background. If I have you stand over here, really at the balloons in the background.
Okay. I just got the notification.
I think you can move over a little bit, just like more towards the table here. Let's do it.
Watch
It's right here, actually.
Alright, I'm actually going to have you look over this way,
Okay.
this side of the camera. If you could just watch and make sure.
Yeah.
Okay. Yeah, perfect. So you are, I'm going to hold the microphone.
Okay.
You just have to look at me.
Alright.
Can you state and spell your name for me?
Wilhelmina Wiese Romish. WILHELMINE WIESE-ROMETSCH.
Okay, and it's Doctor? Okay, so talk a little bit about your first program, first residency today.
Well, today is a very exciting day. It's a culmination of a year and a half worth of work. Our program was initially accredited in April of 2016, and it's the first internal medicine residency program, first residency program at Sarasota Memorial Hospital, and it's in partnership with Florida State University, who's a sponsoring institution, but all of the training will occur here.
Right, again, talk a little bit about the people, the residents.
Absolutely. So today is match day. So all across the country, about 42,000 students, medical students from the United States and all over the world find out where they train. And so for us, that will be today, and it's actually at around 1 o'clock. Actually, probably now people are starting to open their envelopes. So we have matched 13 applicants. We are credited for 13 per year. So by 2020, we will have 39. They are all outstanding, and we're delighted to have them in our program. And in a few minutes, we will hear who they are.
Okay, yeah, and they're going to be at this hospital and also at the Newtown Center, correct?
Correct. So in this hospital, they will be doing their inpatient rotations, and in Newtown, they will be having their own continuity practice. So they're going to establish relationships with patients and see them throughout their 3 years of their training.
Right, yeah, talk a little bit about how important that is for that Newtown community to be able to have access to medical care so close to home.
Well, you know, one of the greatest things that we see with underserved communities is that transportation is a huge barrier. So having access to care in the community that you live in obviously overcomes that great barrier, and not only will they be able to take care of the management of their chronic conditions such as their diabetes and their high blood pressure, but you can also do preventive medicine as well. So we have a lot of partnerships for the community of Newtown to be able to provide and maximize the services that we provide in that side.
All right, great. And talk a little bit about the benefits of having a residency program at a hospital and what that brings to a hospital.
So the benefits of having a residency program are huge. So one of them that is, even though, you know, obviously Sarasota Memorial is a 5-star rating hospital, anytime you have residents and you have students, you raise the caliber of the care that's provided. Physicians keep more on their toes because they have to teach the residents about what they're saying. The residents come back and say, well, here's the latest article or the latest research that shows this. So it always helps tremendously by increasing the care that we provide. Not only that, we hope residents usually stay close to where they train. And so as of a couple of years ago, we were already almost 50 primary care physicians short in the community of Sarasota. So our goal is that we provide them with such an exceptional, not only training experience, but overall experience in the community of Sarasota, that some of them will choose here to stay and establish their roots here.
Right, yeah, absolutely. And you know, I've always been around research hospitals and teaching hospitals, but for people where this might be new to them, they might be thinking, oh, there are students that are going to be working on it, you know. Talk a little bit about, you know, that's not really the case.
Well, absolutely, and thank you for pointing that out. No, it's not the case. Actually, the accreditation body has very strict requirements regarding resident supervision. All of our residents are immediately supervised by board-certified internal medicine physicians that all are practicing physicians at Sarasota Memorial Hospital, and all are Florida State University faculty as well. So we take that very, very seriously. Obviously, patient safety and quality are obviously our top concerns, and so there are numerous mechanisms to ensure that the residents are adequately supervised.
All right, great. Anything else you'd like to add?
Well, obviously today is a very exciting day for us, and soon we'll find out who our lucky 13 are, our 13 stars. So thank you.
All right, great. Thank you so much. Thank you. Great. It was a great meeting you guys. Just when I'm at the session, I like to make sure that someone's watching to make sure. Awesome. That's fine. Perfect. Yeah.
I'm going to bring everybody up.
Yeah, that'll work. Great. And then, yeah. And then you'll be able to see, like, the kids perfect. Great. And, yeah, we can just get someone to talk about after that about the physician training. Because I know we brought in Elena, but I think we have someone who's like established. Great, thanks.
Thank you. Sure, I'm just going to step off the side. Yes, ma'am. I can follow.
You know, we do whatever. Kid pasta chat.
Because of anything. I have it ready. And then I go over there. What I was going to say.
She's a delight.
I actually feel that Gotcha.
I mean, it's pretty small, right?
Thank you. I'm starting to get some yeah, I'm not in here, so I can since it's Tuesday.
Yeah, I've never had one other allergies, and I'm going to check.
Are we going to have people come stand over this way? Everybody's over there, so I'm like talking to Kinsey and not to anyone else.
Hear you.
You're taking all that, right? Yeah. You guys about ready? Okay. Are we live? All right. Well, good afternoon, and thank you for everyone for joining us today. Few events hold more drama or have more impact in the life of a medical student than match day. It's a day that graduating medical students across the country learn where they'll complete their residency and the requirements to become licensed physicians. It's an exciting coincidence that today falls on St. Patrick's Day this year, because we couldn't feel luckier to be introducing our program. In a few minutes, we'll announce the 13 new residents who will complete Sarasota Memorial's journey to become a teaching hospital. Up until now, we've had the privilege of training 3rd and 4th year students from FSU Medical School, but then had to watch as they left our community, our state, and to complete their graduate medical education and fight to get them back here. With FSU College of Medicine, our academic partner, we now can recruit and retain the best and the brightest medical students, not just from FSU, but from across the world, into the new FSU Internal Medicine Residency Program at Sarasota Memorial Hospital. It's taken a village to make this dream become a reality today, but I wanted to take a brief moment to thank our leader, Dr. Wilhelmina Visa-Ramesh, who you will hear from in a moment, but just know how much we appreciate your leadership, and we wouldn't be here without you today, so thank you. I'd also like to recognize that our hospital board has been very involved in this since day one when we started this project and our strategic plan 3 years ago. We are lucky to have our chairman with us today, Mr. Greg Carter. And Mr. Carter, I'd like to ask you to come up and say a few words if you would.
Thank you, David. It's my privilege to represent the board at today's event. I would like to thank you and your leadership, David, for the team for your hard work and dedication. Chief Operating Officer Lori Lang, Chief Medical Officer Dr. Steve Taylor, and our Residency Program Director, Dr. Visa-Ramesh. Although she could not be here today, I'd also like to recognize the hard work of Dr. Karen Hammond, our Associate Program Director, and also Katie Axiotis, who's here with us today. As David said, becoming a teaching hospital was the next logical step for Sarasota Memorial. But it became even more important to the nation's physician shortage as the nation's physician shortage worsened. At least 2/3 of medical students were leaving our state after earning their medical degree due to the lack of residency slots in Florida. The shortage of physicians in our region is more challenging than the rest of the state. We know that many physicians end up practicing near where they complete their residency, so the process of selecting and ranking applicants is a very important one for Sarasota Memorial and our entire region. I had the privilege to be part of the team that met the residents applying to our program. We had more than 4,000 applicants and selected nearly 200 to interview. Over the course of several months, we interviewed and ranked applicants based on the care and commitment they will bring to our community. The interview process was very thorough, and personally I was impressed with the caliber and diversity of medical students that came to us for consideration. My only regret is that we can only accept 13 of them. So at this time, it is my distinct honor to introduce the program director for the FSU Internal Medicine Residency Program at Sarasota Memorial, Dr. Wilhelmina Visa-Ramesh.
Thank you, Mr. Carter. As you recall, this journey started a few years ago, but about a year ago, in April of 2016, we received accreditation and commendation by the Accreditation Council for Graduate Medical Education. We were approved for 13 residents per year, for a total of 39 residents by 2020. In a few minutes, we will find out the names of our first-year residents that comprise our inaugural class. But to echo what was said earlier, today thousands of medical graduates from all over the country and all over the world are going to learn the specialty and location of residency programs where they will train. In internal medicine, the period of training is 3 years. Other specialties are longer. So for example, if you're going to be a neurosurgeon, you train for 7 years. This year has been the largest match in the history of the National Residency Matching Program, exceeding 42,000 applications in more than 4,800 residency programs across the country. As we speak, medical students are actually opening their envelopes to find out where they will go. So just to give you a little bit of an idea of what the process entails, in the fall, students actually apply. So by September 15, which is the day that the match opens, this year in 2016, we already had, as it opened at 9 a.m., 2,500 applications from the get-go. And you're thinking, how are we going to go through this, right? And that number increased to about 4,000. Then between the fall and winter months, the applicants come and interview. From about mid-January to February, we actually rank the applicants and they rank us. And so then a computer actually generates the matching process, and they use a pretty fancy algorithm, and then today is when we find out. So on average, programs that fill rank about 11 to 12 individuals per spot. In our case, we ended up interviewing a total of 171 and ranked 137. As a program, though, we were specifically looking at individuals that wanted to stay in Florida or had ties to Florida, but that also excelled in their humanistic skills as demonstrated by their work either with vulnerable populations or displaying the attributes that contribute to our community. We were looking at the whole thing, the whole person. So it is with great excitement that we announce to you our first class. This slideshow is in alphabetical order, so I will tell you. First we have Talal Al-Khayali. Talal went to medical school at Jordan University of Science and Technology. He has volunteered to assist Syrian refugees in Jordan while he was there, helping with medication and food aid. He's currently in California and is conducting colorectal cancer research, and he has actually family in Sarasota. Amar Baha attended Sabah University School of Medicine. He actually did his undergrad at the University of Massachusetts in Dartmouth. He volunteers at pain management clinics in Massachusetts and has done tremendous work in AIDS prevention programs. He's tutored in medical school and is recognized as a member of the Alpha Omega Pi Honor Society from his university. Caitlin Bass also comes to us from Sabah University. Caitlin grew up in Gainesville, and her entire family is here in Gainesville, Florida. She is attended to undergrad education at the University of Florida. She has served as teaching assistant in neuroscience and psychology during medical school and worked as an editor of the Medical Student Press. So she actually has had several publications in the works. Derek Hopkins attended LECOM here in Bradenton and did his undergrad work in the University of Central Florida. He has done a lot of volunteer work tutoring middle school students at Manatee School for the Arts in Bradenton for quite some time. And he had a previous career as a mechanical engineer and decided that he really wanted to pursue his dream of becoming a physician. His whole family is in the Orlando region, so we're very happy that he's joining us as well. Ijeoma Eklis James, IJ is how she goes by, graduated from the American University of the Caribbean. She had completed a master's degree at the Imperial College of London and undergraduate education at the College of Worcester. She has volunteered extensively for the Ministry of Health in Sierra Leone, where her family is originally from, and she has conducted bench work in the area of HIV and malaria, actually quite extensive. Her number of publications are amazing. She's a member also of the Alpha Omega Pi Honor and Service Society. She's a member of the Black Medical Student Association and the American Medical Association Student Judiciary Committee. Elena Gerasimova attended St. George Medical University. She did her undergrad at the University of Michigan and actually has volunteered extensively as English teacher and activity teacher at children's camps in Russia. She has worked with underserved population and the homeless and has conducted extensive bench research in neurology. Christopher Jenkins is originally from Georgia. He attended medical school at Ross University and had obtained his master's degree in Mississippi and had done his undergraduate work at Georgia State University. Chris has tutored anatomy. He's conducted projects to provide increased access for HIV testing for underserved communities. And he served also as the president of the Dominica Martial Arts Club. And is a Taekwondo and self-defense instructor. And he volunteered to teach all of our residents that if he were to come out here as well. Mallory Kinsey went to medical school at Nova Southeastern University College of Osteopathic Medicine, and her undergraduate education was the University of Central Florida. She grew up in Clearwater. Her family is also in the area. She has volunteered at the Samaritan Free Clinic in Alabama. She's tutored anatomy also during medical school. Marilyn Mosquera attended also St. George's University School of Medicine, did her undergraduate education at the University of Central Florida. Her entire family is in the Orlando area as well. While she was in St. George's in Granada, she volunteered and organized weekly visits to their orphanage. She's committed and passionate about primary care. She's also volunteered extensively in free medical clinics across the state. Policia Petrenko is graduating from Michigan State University College of Osteopathic Medicine. She is from Canada and had done her undergraduate education at McMaster. And she has volunteered extensively to assist orphan children in the Ukraine. She has a lot of bench and clinical research experience from her years at McMaster. Belissa Ramos trained at Universidad Iberoamericana School of Medicine in Santo Domingo and is originally from Puerto Rico. She also has volunteered extensively to provide first aid and necessities to the homeless in Puerto Rico. She has conducted research in HIV while she was in the Dominican Republic. She's a professional basketball player, and her family, her grandparents, are actually in the Orlando area as well. Juan Ricardo attended Pontificia Universidad Católica Madre y Maestra, also in the Dominican Republic, where he conducted actually research in the prevalence of psychiatric disorders in substance abuse patients. And his work has been extremely important in the Dominican Republic to have a better understanding of this. He also has coordinated medical mission trips, not only participated, but helped coordinate and bring physicians from the United States to the Dominican Republic. Ahmed Salem attended medical school at the Suez Canal Faculty of Medicine. He has volunteered extensively for the Egyptian Association of American Medical Training and Research to assist Egyptian medical students. And actually, he's one of the founders of that group. He has conducted extensive research in gastroenterology and surgical oncology. And one of his mentors is actually Dr. Kenneth Meredith, and he did extensive work while they were at the University of Wisconsin together. So we're very delighted to introduce to you our inaugural class, and so thank you very much for this opportunity. Thank you.
I think that's it. I think that's it. So please help yourself to refreshments and stay as long as you'd like. Alan, you have to go back to work, I know. But yeah. Thanks everyone for being here.